Our next presenter is Dr. Lauis Paluku Sabuni. He is the country leader of the Leprosy Mission, Democratic Republic of Congo. And as a country leader, his work focuses mainly on supporting national leprosy program, local churches and local organizations of people affected by leprosy and disability. Dr. Paluku will be speaking on the impact of revitalizing traditional healers as community health workers in wound management to prevent disabilities, Democratic Republic of Congo.
Thank you very much. I'm from Congo, DRC, and we speak French mostly, but I'll try my best to speak in English. What I'm presenting here is from our experience in DR Congo as people who work with leprosy affected people. And as you may know, we every day experience wound. Once you work with people affected by leprosy, one of the first and the sad experience you go through is working with people with wound. And this is not only for people affected by leprosy, but also other entities like onchocerciasis, LF, and so on. So I have been working for TLM Congo for 10 years now. And TLM, the Leprosy Mission, work with the Ministry of Health. We work with the local churches, with local communities, and TLM Congo supports 6 provinces out of 26 of the country, where we have almost 18,000 people living with leprosy and disability. And when we empower the local staff or maybe the health system, we train doctors and nurses on how to support people in their community. We set up associations of people affected by leprosy, but also we do support livelihood activities within villages. We also train the local authority in the human rights-based approach, because sometimes they don't feel like they are responsible for what people should be getting. We empower local church. At least local churches are the place where poor people can have some support. In the very easiest way. We have also a new approach of child-to-child approach to help children get familiar with hygiene and safety. So what I can say in brief, wound care in DR Congo is not part of the health system. And our question was, how can we support this issue as it has been left behind by the national health system to make sure we prevent the disability due to wound. So we developed a small protocol, very easy one, and the objective was to reduce mobility and disability due to wounds and ulcers among people affected by leprosy, as well as NTDs like Buruli ulcers, leprosy, Yos, LF, and so on. The approach we used was recycling traditional healers to make sure they understand what they are doing, because most of the people who used to go to see them, but they were not going to the hospital and the national health system because they were not accepted there. And we were able also to empower them with basic equipment to use to heal wound. And this basic equipment, it is only simple things like soap and water and sugar. So the content of the strategy is there. Traditional healers where we did a census of traditional healers in the remote villages. We then built trust. That is what was lacking very much between health professionals and also traditional healers. We identified needs, strength, and opportunity in this, and developed curricula for training. And also, how many do we have in the country? I think there should be more than that. This is just the idea in the 6 provinces out of 26 we have in Congo. We just did the census of 6 provinces, and we do have 237 traditional healers. We have many more than that, actually. This was the key approach we did, because there was no big trust between traditional healers and health professionals. What we did was to try to remove from the head of the health professionals who have a tradition. I mean, they have a colonial training. They have already colonial attitude. So they have some sneaky acts. They have a colonial attitude, a police approach. So we have to destroy that. And build the trust so that they can trust the traditional people living there. And then we were able to build trust of the traditional healer themselves by conducting a workshop. In that workshop, we did some reliable activity, and to help them be honest, being open, help them show their integrity when they do their work. Because what I can say here, traditional healers mainly, they were using very harmful products on the wound, and many people have died because of that. So we had to train them in this approach to make sure they are doing good practice. Then we did identify some strength and the needs, the strength and the opportunity. One of the needs was the traditional healer, they don't have microbe. They don't have a microbe knowledge, microbe concept. That was one of the topics.
Dr. Lauis, you have a couple of minutes.
Thank you. They have the strength they have. They are trusted by the community, and therefore we had to train them of the use of a very simple thing, local thing that they can find there: soap, water, sugar, and rest. And then the wound was healed. So the soap was there to clean the area, and the sugar was put once a day. The dressing was used. We were using the local cloth they have in the house, and they needed to have rest at household. The outcome was amazing. 200 patients in 4 provinces of the study, they had their chronic wound healed in less than months. Traditional healers were trained in simple technique of how to heal wounds, but those who were not healed, they were sent to a hospital. And here you have a case where the wound was a big one, using water and soap. After less than 1 month, that is the wound already healed. Here we have a woman who had a very big wound on his foot. And then after 1 month, you have a very cured and very happy, able to do her work. Here she was a very bruised ulcer. And after after one, I think that was more than 1 month, he got skin put on it and graft, what we call it in French, and then she was quite good. So in terms of conclusion, what was missing here was trust. So trust and sympathy can change the lives of many people. This is what I can say in short. You can read the poster in the website. Thank you.
Thank you. Thank you very much.